thinking that COVID is over. People are saying that it no longer exists, and we have dropped our guards. And we also know that government is also not very keen in implementing the public health policies around the distancing, mask mandates, and all that, because of the economic impact that it has also caused as a nation. And so, as a union, we'd like to ask everybody to be their own keeper by ensuring that they get the vaccine. We now have vaccines available. As of yesterday, only 10 million Kenyans had been vaccinated against a vaccine availability of around 30 million. So we still have 20 million plus vaccines in the fridges, and some of them have expired and been thrown away, and that's not very encouraging. So I'd want all of us to be responsible citizens and go out there and get vaccinated. If there's any message that you can give your loved ones this festive season, is let them go get vaccinated, because the only and the surest way of beating this virus is through vaccination. Yeah, there have been myths and lies and misconceptions that have been propagated against the vaccine, but as we've been able to highlight every day, is that some of those lies or the myths have proven not to be true. By and large, the vaccine works with very, very minimal side effects. And so I would like to tell our people that if you have any issue that you'd want to be clarified for you before you get the vaccine, or any issue that is stopping you from getting vaccinated, please go to the hospital, meet any healthcare worker and ask those questions. Then once you get the clarity of information, please get vaccinated. Yeah, issues around that the vaccine causes impotence, that the vaccine causes people to lose their fertility, this about the vaccine being a mark of the devil, all those are just propaganda. Yeah, the 10 million people got vaccinated are alive with us today, and I don't think that they have really gotten anything that would make us think that the vaccine was a problem. And I don't think that governments across the world would give their citizens something that is poisonous. Yeah, so please, I want to encourage our fellow country men and women that let's vaccinate children, the elderly, and even pregnant women, because we've seen how the virus, the effect on the pregnant woman. So I'd request that we take all the women to get vaccinated, even the pregnant ones, because it has been shown that the vaccine has no side effects or any deleterious effect on the unborn child. Thank you very much.
Maybe if you kindly just briefly tell us about the numbers that you're talking about so far, the breakdown so far when you have vaccinated.
Yeah, so we know that we have 10 million Kenyans who have been vaccinated as of yesterday. Yeah, we have quite a number of teenagers, around 2 million, that also getting the vaccine. The biggest challenge has been amongst the pregnant women, where the challenge was that the myths and the lies around that cohort. But by and large, the challenge that with the loosening of the public health initiative and like the mask mandates and the social distancing, people have come to believe that the vaccine is over. So fewer and fewer people are turning up to get vaccinated. More people are sitting back and staying at home, assuming that this virus will just wane away. But until we achieve around 70% vaccination, we are going to struggle with clearing this virus. The numbers are going up world over. From China, in Kenya, we are projecting the rises. And I'd like to tell people that the vaccine is the only surest way of protecting yourself from the virus. There's nothing else. The drugs and all that, especially in our setup in Africa or in Kenya, where our services, ICU services, are still very low, number of doctors are still very low. The only sure way is by you avoiding to fall sick. Because when you fall sick, I think that we might probably suffer more harm than maybe other areas in the country.
In preparation of the 7th of May, what are your recommendations, especially now?
Yeah, so as Kmpdu, we have always been out there talking to all the people in authority on what they should do. First of all, we insist that they must continue hiring enough healthcare workers, because treating a COVID patient is very, very intensive on the kind of care that they need. So they need to hire more nurses, more doctors, more clinicians, and avail more testing services. Yeah, governors were challenged to build oxygen plants, I don't know how well they're functioning, and I'd like to challenge Kenyans to ask them about that. There were challenges about them having to build ICU beds. They all promised to build 300 ICU beds per county. We would like to see those beds, because beyond the virus, the pandemic, we'll still need those beds to cater for any other emergency, because our scientists are projecting that the pandemics are going to be there. COVID was just one of them, but the global warming, the climatic changes, we are going to have more and more pandemics coming. So we have to be ready and responsive to those health challenges as they come. Thank you.